Judge. My name is Thuỷ Nguyên. I'm from West Vân Hà School. Today, I rise the clarity and conviction to champion a policy that reflect the future we demand to create with responsibility, purpose, and the courage elite. I affirm the motion before this House. This House would heavily subsidize organic food. Firstly, we want to define what is heavily subsidized in our world. We frame as providing financial support for organic farm system and supply chain to narrow down the price gap between organic and conventional food. To begin with, the government spending for organic farm is essential to reserve the biodiversity loss, soil degradation, and water pollution caused by synthetic input. A peer-reviewed study shows that the groundwater from organically managed farm has low concentration of nutrient pollutant such as nitrogen than the concentration from groundwater of intensive conditions. Not only exhibit lack of pesticides, organic farm also help in recovering biodiversity. A meta-analysis report that the organic farm support 30 to 34% higher species richness than conventional farm. There are long-term evidence indicated by South Sweden that arable plant biodiversity increased substantially with a number of years by organic management. By eliminating the pesticides and fertilizers, also relying on ecological pest management, the organic farm preserved the pollinators and soil biota by reducing the runoff. As a resource, the subsidized organic farms not only regenerate the biodiversity, but also protect the soil and water.
Alongside with that, subsidizing organic foods is a public health investment. Making organic food affordable reduces population level exposure to agricultural chemicals and improves diet quality, especially for lower income families. A research shows that when people switch to an organic diet, their urinary pesticides metabolites decline markedly within days, according to Highland. And organic foods contain about 5 times fewer pesticide residues according to Gomez Ramos. So reduced chronic exposure and improved nutritional profiles, enhance physical and cognitive outcomes, which ease the future healthcare burdens. In a sense, this motion shifts policy from treating illness to preventing it by reducing dietary pesticide exposure at scale. Lastly, this is a matter of justice. Healthy food should not be a privilege of the wealthy. At present, healthy and organic options function like a luxury good because low-income households cannot access them. The reason is limited production keeps prices high, and high prices in turn suppress distribution in low-income areas and food deserts. This creates a structural accessibility gap that only government intervention can correct. A heavy subsidy would therefore expand the distribution system and narrow the affordability divide. This was explained in the research, Neighborhood Disparities in Access to Healthy Foods and Their Effects on Environmental Justice.
Even if the organic farm offer localized biodiversity and residue reductions, this benefit collapse when scaled because organic farm low yet demand more land, raising deforestation pressure and water use. Meanwhile, the conventional food has already met the pesticide safety threshold and health gains are marginal. Also, because the organic buyers are disproportionately wealthy, heavily subsidized would channel public money toward those least in need while doing little thing to improve national food access and environmental outcome.